Today I will talk about some basic points to consider regarding frontotemporal angle in a hair restoration surgery. A frontotemporal angle lies at the junction of the frontal hairline and the temporal hairline somewhere here. So this is present on both the sides, and a normal male hairline is basically M-shaped, and the apex of frontotemporal angle is on both the sides like this. The first mistake that happens is the placement of frontotemporal angle is much lateral to the exact position that it should be. So what happens in patients with extreme grade 6 and 7 baldness, when the temporal humps have receded a lot, the hairline meets the temporal point here. So the point is lying much lateral to what is the desired position. Now how to determine the desired position? This is called the lateral canthus of eye. So if we take a plane passing along the lateral canthus of eye, it should meet the hairline somewhere here. So this should be the exact point of frontotemporal angle. So the frontotemporal angle should lie in this plane, whereas in the current scenario it is lying much lateral to the proposed location. A very important point to consider now is that the distance between the glabella and the lateral canthus of eye is lesser, whereas the distance between the mid-frontal point and the frontotemporal angle will increase. Why? Because head is a curved structure, not a flat structure. So that is why this distance between mid-frontal point and the frontotemporal angle is more, and the distance between the glabella and the lateral canthus of eye is less. One more mistake that can happen is blunting of the angle, not making the frontotemporal angle at all. So every day when we make the hairline in the morning, sometimes what happens is the patients want us to make a straight hairline and they don't want this M shape to happen, and they want us to cover this area completely. This gives rise to an extremely unnatural and a feminine kind of hairline. In such patients, after they achieve full growth of the transplanted hair, they see that this is an unnatural hairline, and then they start shaving these unwanted hair to have an appearance of a natural M-shaped hairline, and sometimes they come to us for extraction of these unwanted grafts. So this is a very common mistake, and we encounter it every day in the morning when a patient is not educated about the normal hairline anatomy. They ask us to fill these areas, but then we have to show them a good hairline picture, and we have to show them the picture of the hairline from various angles to convince them that this is an unnatural shape, and a normal male hairline should have a deep M or a superficial M. Another important point is the shape of the hairline, whether it is concave or convex. So as we move from the mid-frontal point laterally, ideally there should be a convexity. A convexity gives rise to a natural and a non-bald look, whereas a concavity will give rise to a unnatural and a bald look. And because of this concavity, the frontotemporal angle will be lying more laterally. It will look flared and obtuse. An ideal angle should be acute, but in this situation the frontotemporal angle will become obtuse and the hair will be flared in that area. So now let us see a normal hairline shape. A normal hairline shape, it goes from the center laterally in this manner. There is a small peak usually in the center at the mid-frontal point. Then as it goes laterally, there is a small peak in the mid-pupillary line, and after this point there is a sharp turn inwards, giving rise to an M shape. And as we can see, a typical frontotemporal angle is M-shaped. It is lying along the lateral canthus of eye, and it looks very natural. So nobody will be able to tell that this is a transplanted hairline once all the hair have grown.